Record. Perfect. So we are officially recording. So this Sunday, you guys, we are covering mental health drug dependency. That is a single concept. Normally, you guys know when I cover mental health topics, I normally do two or three concepts in one presentation. But tonight, however, we are just hello, Jasper, familiar face. So you guys know we're just covering drug dependency. So what I've done is I've broken up the webinar into three sections. We will cover each section, take a breather, and then we'll get into our NCLEX review questions. So before I start, those of you who have been with me before, you'd always know what I'm going to ask. If everybody would please type into the chat, let me know where you guys are from. Hello, Juliet. Girl, I was looking for you. Hello. So you guys already know what to do. Type into the chat. Let me know where you guys are from. For those of you who don't know, I am in Miami, Florida, and it's been surprisingly hot. Normally a little hotter than it normally is here in Miami, but if anybody's been in Miami, you know how our weather is unpredictable, hot one minute, raining like a hurricane coming through the next. Hello, Canada, as usual. A familiar face, Miss Muhammad. Jersey, hello. Kenya, hello. Jamaica, hello. How are you? Who's that? Dallas, Houston. Okay. Jersey again. A lot of Jersey people. Philippines, hello. Virginia, Connecticut. Saudi Arabia, hello, Comfort. Welcome back. Jasper, Cali, hello. Okay, good familiar faces. Look like my normal crew is here. Okay, hello, Maryland. And of course, Canada. Juliet, I know where you're from. Virginia. Hello, Pittsburgh. Okay, good. Like we're a little spread out. I like that. So, for those of you who are joining me for the first time, okay, I like hello, West Palm Beach. Hello, neighbor. So, you already know what I'm talking about when it comes to this weather. Hello, Haiti. Welcome. You know what I'm talking about with this weather. So, what we're going to do, you guys, those of you who are brand new to my webinars, I like my students to be active. I like my students to type into the chat, ask questions as I'm lecturing. If you want me to review something, if you want me to clarify, please do not hesitate to either unmute yourself and ask, or if you don't feel comfortable, you can always type into the chat. I do check the chat regularly throughout the webinar, especially if I see a notification pop up. Again, Kenya, Ghana, Nigeria, hello. Wow, a lot of overseas people in here tonight. Welcome. I'm not sure what the time frame's looking like, but thank you guys for joining. Okay, so let's get into it. Okay, so again, we are doing just drug dependency. I have broken up the webinar into three sections. We will cover each section, take a short breather, and then again, we'll get into our NCLEX question. So these are our objectives for tonight's webinar. Okay, so we're going to get into what drug dependency is, going to clarify maybe some misconceptions about what drug dependency actually is, break down the concepts, the definitions, get into how it is, identified, how it's treated, responsibilities of the nurse. Okay. And just again, go into some basic topics to clarify exactly what drug dependency is. I have my phone nearby. You guys know how Siri is. I say something, Siri picks up. So if you hear my phone, that's Siri reacting to the webinar and things I'm talking about. So just some little general information. So, what exactly is drug dependence? Okay. It is a compulsive craving that develops as a result of repeated administration of the drug. So basically, what happens if a person takes a particular substance? Now, we're normally talking about drugs such as, opioids, which we'll get into individually, hallucinogens, inhalants. So we're talking about drugs like that. Now, keep in mind, this can also develop with alcohol. This can develop with substances like caffeine, but we are specifically talking about drugs that people take, substances. Okay, so what happens is when a person exposes themselves to a particular medication, drug for an extended period of time, they can develop a dependence on the drug. Now, we will clarify what dependence means separate from addiction, because a lot of times dependence and addiction are intertwined, and they are actually two separate things when it comes to drug usage. Okay, so with the drug dependence, a wide range or a wide variety of drugs can cause a dependence to happen. That is why we have to be very careful when drugs are prescribed, that we educate clients how to take the medication appropriately. signs and symptoms and things to look for. Very important if you are taking a medication and it doesn't feel like it's working anymore, or the effects that you used to feel, you don't feel anymore. It's very important, to call the clinic so we can talk about it, because those are, things that we look for to see if a client is possibly on their way to being drug dependent. Common feature, okay, is that it is a positive reward for taking the medication repeatedly. Okay. And when we say a positive reward, they get a type of a feeling, a type of reaction. And for some people, it is a good feeling and they want to continue feeling this. So they use the drugs more and more and more. They take the drugs outside of how it is prescribed. And then they develop a dependence, which can turn into tolerance, which can turn into addiction, and so forth and so forth. Now, there are two types of drug dependence, or two categories. Okay. A person can have a physical dependence, or a person can have a psychological dependence. So, drug dependence can affect not just the body, but it can also affect the mind as well. It is not the same as having a drug addiction, and we will clarify that on the next slide. Okay. Again, it works as a reward system. When a person takes a medication and they get a desired effect, they feel good. Who doesn't want to feel good? Especially if you've been feeling bad, which led you to, get prescribed the drug. So you've been feeling bad for so long and you start taking this medication, and you know what? It feels good. Okay, it takes your pain away, or you are seeing things that make you happy, whether it's a hallucination, but you feel good, you're seeing things, you're hearing things. And what happens is you want to have that feeling more and more and more. You rather have that feeling than anything else, so it causes you to repeatedly use the medication or the drug, like I said, outside of prescribed orders for an extended period of time. Now, not just prescribed drugs can be cause dependency. They're illegal drugs as well that can cause dependency. So you could get dependent on drugs that are legally prescribed for certain conditions, and you can gain dependency on drugs that are illegal. Okay, and some drugs are legal in certain states, like for example, marijuana, which we will talk about. But then there are certain states where marijuana is not legal, so it is considered an illegal substance. Okay. So, what is the difference between physical dependence and psychological dependence? So, remember, physical is the body, psychological is the mind. So, with physical dependence, the body adapts to chronic drug use. Now, when we say the body adapts, we're talking about physiological responses. Now, if you guys know what Maslow hierarchy of needs is, and it's very important, you know what that is. When you're taking your NCLEX, okay, and you having trouble answering some questions, you got to use your test taking strategies. And Maslow is one of those strategies that you can use to help you get a better chance of answering a question correctly. So with Maslow, the very first level of need is what we focus on, because that's what Maslow says. Maslow says there are different levels of needs an individual has. And in order to get to the next step, you have to meet the need that you are at first, and then you can move up. If you meet that need, you can move up, and so forth until you get to the very top of what it is that an individual needs. Now, physiological needs is the most basic of needs that Maslow says an individual has to have met. Okay. If you do not meet physiological needs, a person cannot be stable. Okay. And it doesn't matter what it is, the person will not have balance. The person will have, issues, and you cannot move forward in meeting additional needs if you have not taken care of the most basic of needs. And again, that is what physiological dependence can happen. So when we say physiologically, we're talking about your breathing, we're talking about your heart rate. Okay. We're talking about your just daily functioning. Your body operates functionally because your body has gotten used to this medication. If you remove this medication from your daily routine, your body is going to react. Think of it as you cut off your air supply. Okay, so the drug is now your air supply. And if you cut off your air supply, the basic of basics breathing, you will not be able to do. So that is what happens with physical dependence. You remove the drug, you become accustomed to it, and now all of a sudden you can't function properly. Okay, with the adaptation to this particular medication, you can develop different types of symptoms. Okay, tolerance and withdrawal. And it is very important if you have a client that's taking certain type of medications, that you monitor them for the development of tolerance and the development of withdrawal. Both of these concepts can become complex and it can cause a lot of issues with your client, even possibly leading to death if it is not taken care of appropriately. So, what exactly is tolerance? So, let's say you've been taking a medication for an extended period of time, and I'm going to use an opioid as an example because opioids are very common prescribed medications when people have pain. Okay, so let's say you've been taking this opioid for a while. You know, you had a really, really big surgery, and Tylenol and Motrin just not gonna do it. It ain't enough. So the doctor says, you know what? I'm gonna prescribe you a Percocet, or I'm gonna prescribe you, morphine. You can't take morphine outside of the hospital. Now, as you've been using this opioid for an extended period of time, you're going to notice your pain is not getting relieved like it used to when you first started taking the medication. In the beginning, you started taking the Percocet, and within some time, your pain felt better. It might not have disappeared 100%, but it was tolerable. It was less painful than it was before. Basically, the drug was working. Oh, hello, St. Louis. The drug was working. Okay. So, with tolerance, you are going to notice that the medication is not working. I've been taking this same prescription strength for the past whatever month, 2 months. It used to work, but now I'm noticing I'm sticking to my prescription, but my pain is not being relieved. This individual has developed tolerance. Okay, your body has gotten used to the medication, your body has gotten used to the dosage. Therefore, it is not working like it was before. Now, one of the only ways to combat tolerance, one or two things can happen. The doctor can increase the dose of your medication, or they can find an alternative way to treat you. Now, it makes sense to increase the dose. Okay, if your body has developed the tolerance to 3 milligrams, we're going to increase you to 4 milligrams, 5 milligrams. So it makes sense. It's an easy fix. However, keep in mind, certain opioids are very potent. They have very high risk for adverse effects. So sometimes increasing the dosage is not the best thing. Think about an elderly client who has, let's say, some issues, body system issues. Would it be wise to increase an opioid, or would it be safer to find an alternative route to treat the client? Instead of increasing the dose, let's add something else, or let's explore other options. Okay. Now, what if you have a client that has asthma? Okay, they already have trouble breathing, or they have COPD, chronic obstructive pulmonary disorder. They have trouble breathing, they're taking a medication like morphine. Now, they have developed tolerance. Would I increase the dosage? I already know they have trouble breathing. Okay, they have asthma, they have COPD. Those of you in the chat, what is a very, very common effect that people can experience when they're taking morphine? Something that you generally have to overlook for. One of the main things you need to look for. What about the respiratory system? What can happen? Constipation is one of them. Now, if I was to categorize the importance of, let's say, what would I, the most important effect, respiratory distress or respiratory depression? Yes, it can cause constipation. Yes, it can affect the heart rate. It could even affect the kidneys. Absolutely, Jasper. But if I was to categorize the importance, I'm going to say respiratory depression. Also, CNS depression as well. Absolutely. So if I have a client that's already struggling in those areas, I probably would think twice about increasing the dosage of an opioid because it can potentiate or make their coexisting condition even worse. So that is why another viable option would be to just alter or maybe just explore other options for this client. Okay, exactly. You absolutely can. Now, then you have withdrawal. Okay, withdrawal is another condition that can develop with drug dependency when you have physical drug dependency. So, withdrawal symptoms are symptoms that are very unpleasant. Your body has become used to a particular medication, your body has become used to a particular drug. And let's just say you stop abruptly taking that medication, or you abruptly stop taking, everything will be high. Exactly. You abruptly stop taking that drug, you abruptly stop taking that medication. Now, what's going to happen is if your body has developed dependence, Okay, you're going to have some very, very unpleasant symptoms because your body is no longer having access to that medication or access to those drugs. It is called withdrawal. Okay. And withdrawal typically starts out as a headache. That's one of the most common first initial signs. You might have some nausea and vomiting or just typically GI disturbances. Now, depending on how much dependence your body is to the drug, meaning how much have you taken. Some people can have a mild dependency, some people can have a very severe dependency. So if you have withdrawal symptoms, it's really going to depend on how severe your dependency is. You can have mild symptoms that are very tolerable, or you can have very severe symptoms. Those individuals who experience those severe symptoms, it is not a pretty sight. They are in a lot of pain. They just feel horrible. And the problem is when you have a severe dependency and you try to quit, if you don't get the proper help to help you quit, it's very hard to do it on your own when you have a severe dependency because your withdrawal symptoms are so severe. It's almost like I would rather be on this drug. I would rather take this drug. I would rather have an addiction. I would rather have all of that bad stuff that I know is no good basically besides feeling these withdrawal symptoms. So I would rather be hooked on the medication than go through withdrawal. When it is that serious, the individual definitely needs some professional help to help them with that dependency. And then you have your psychological dependency. Now, this is all about the mind. Okay. And as we know, the mind and the body are very separate. A person can have a physical disability, but their mind is 100% intact. Okay. So we no longer look at the mind as the body as functional, one functional concept. They're two totally different things. So with psychological dependency, it is more of an emotional, a mental reliance on the drug. It is a compulsion. And if you guys was with me when we talked about OCD, okay, we talked about how compulsion is a mental health disturbance. Okay, we talked about the consequences of compulsion. With compulsion, the need to do or the need to have is so overwhelming, it doesn't even matter what the consequences are. It's like your body, you crave it. Okay, craving, compulsion, those are mental related terms. You are craving the drug. You can't, emotionally, you're a wreck. You're not stable emotionally unless you have access to this medication. Okay. With this craving, with this compulsion, you can lose control. You feel like everything is spiraling. You don't have a grip on what's going on. You can't function properly. You can't think straight. You can't focus. You can't, your judgments may be off. That is all mental related. And that is what happens when you have a psychological dependency on a medication. With psychological dependencies, we focus on the cognition and the emotional aspects. We focus on what's going on with the mind when you're not in the presence of this medication. What do you feel? Okay, how do you cope without that medication? If you're telling us, listen, my whole life is disrupted when I don't have access to this drug, when I don't have access to this medication, okay, it sounds like you have a psychological dependency. Okay. So, what is the difference between dependence and addiction? Now, sometimes these terms are interchangeable. However, they are actually two separate concepts. And we want to make sure you guys know the difference because let's say you do see questions like this on the NCLEX, okay? And they're asking you something specific. You don't want to be generally speaking and get certain terms mixed up. Okay. So dependence is when your body physically relies on a drug. Okay. Remember, we talked about physical dependency. You can also, throw in psychological dependency in there as well. Now, the difference with addiction and dependency, okay, it does not necessarily control your behavior. Remember, when we're talking about dependence, okay, you may not necessarily be under the control of the drug. Like maybe, you can go a day or so without it and you're still functioning. It's not like you just constantly thinking about it. When you have the compulsion in some ways that could, you know, be underlying addiction. Okay, so that's why the mental health, the interview is so important. The assessment is so important. That's why we want to know when you're not in the presence of this drug, when you don't have access to this drug, how do you feel? Okay, again, if you're telling us that I can't focus, I can't this, I can't that, not only have you developed dependence, you've also sound like you develop an addiction as well. So yes, you can have dependence and not necessarily have addiction. Okay. So I'll give you a perfect example. Okay. Let's say that at one point in my life, I was in a space where I wasn't doing very well. I had a lot of problems, whether it's work related, family related, finance related. I had an issue, I had a problem, and I was having trouble coping with whatever was going on in my life at that particular time. So I started using drugs. I may have pretended I had an issue and I got a prescription for pain meds. I got a prescription for any type of med that's possibly can cause dependence. And that is how I'm coping with my situation. So I now have access to a drug and I've been taking this drug for an extended period of time. Now, fast forward to today, I'm doing much better. I have my finances under control. My relationship is under control. I'm having, I have a great job. I have a great life. Everything is better, way better than it was back then. However, I have been taking this drug for such a long period of time, I have developed dependency. Now, I am no longer in that headspace where I felt like I needed to take something. So now I know for a fact I don't need this medication. I don't need this drug. I'm doing a lot better than I was before. However, if I do not take this medication, if I do not take this drug, I'm going to feel a certain type of way. I'm going to go through withdrawal, and I don't want to feel like that. So, I take the medication, I take the drug, not because I need it, or at least I think I need it. I take the medication, somebody is unmuted. Give me a second. Let me see who that is. Your phone. Got you. So again, I know that I don't need the medication. I'm no longer in that headspace. But again, if I don't take this drug, if I don't take this medication, I'm going to have withdrawal. So I'm going to continue to use this drug knowing that I'm going to, it can have negative consequences. It can harm me. But again, I don't want to go through withdrawal, so I'd rather take the medication. Now that's dependency. You see, my mind is not wrapped up in the medication. My mind is not controlled by the medication. I have good logical reasoning skills. I know that this is wrong. I want to stop, but at that present moment, I can't because I'm going to have withdrawal. So I'm making a conscious decision, understanding the consequences. I'm going to take this medication. That is dependency. Now, addiction, on the other hand, totally different. Addiction controls behavior. Addiction, now that's where the compulsion comes in. So I want to make sure I clarify that because I did mention compulsion with psychological dependence. But when the compulsion comes into it, that has now turned into addiction as well. Okay. So not only has your body become dependent, but you are now addicted to the substance because it controls the way you think, it controls the way you act. And it's not just drug dependency. You can have a shopping addiction, you can have a gambling addiction, you can have an alcohol addiction. Okay. It's almost like if you don't have access, you just can't function. Okay. And until you get access to that medication, you're a mess. Okay. When you are on that substance, when you do have access, it's like you functioning a lot better. That is addiction. Okay. Again, that is dependence and that is addiction. So that is dependence that has turned into addiction. Okay. Um, when you have addiction, I'll give you another example. Let's say that you took a drug to feel a certain type of way. And I'll give you an example. I'll say a rush. A lot of times when people take certain drugs or they use certain medications, they get a rush. They get a good feeling. Now, you do know that you can get that same feeling doing other activities that are relatively safer than taking drugs or abusing medication. However, you know that, but you still choose to use the drug. So it is no longer about the reward. It's no longer about I'm taking this medication because I want to feel good. Because you know there are other ways to achieve that same feeling. You just don't want to do it because you're so hooked up on taking this medication. Now that again is addiction. Okay. With addiction, you have difficulty stopping. Okay. Because again, it is a benefit. Now, with dependency, you just don't want to feel withdrawals. You don't want to feel bad. When it comes to addiction, it doesn't matter what you feel. It doesn't matter what happens to your body. It doesn't matter how your relationships are destroyed. It doesn't matter if your work is destroyed. You are still going to compulsively want this drug or this medication. So that is the difference between dependence and addiction. Now, when we talk about possible coexisting conditions, that is what comorbid means. Okay. A lot of times, certain conditions that people have, it appears worse than what it is because they have something coexisting. So, when it comes to treating people for certain conditions, we want to make sure that there is nothing else going on with the client that can interfere with treatment. Okay. So, I'll give you an example. Some people, when they have certain mental health disorders like depression, okay, it can also accompany diabetes. It could accompany cancer. You're really, 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 really sick. Your life has changed completely. You can't do the things you used to do. Okay, so because of that cancer that's, maybe terminal now, because your diabetes has gotten so out of control, your kidneys are starting to shut down, or your eyesight is starting to fade away. You develop depression. You may decide, you know what, I'd rather just drink alcohol. I'd rather just take a bunch of pills. I'm already getting opioids because I have pain. I'm just going to take a bunch of them to just, get away for a little while. So a lot of times when there's a comorbid condition, we have to try to treat both. Okay. We don't look at it as one. We look at the dependency as one thing and we look at the other condition as another. Okay. And it's really important because sometimes you can't prescribe medications to take at the same time because they interfere with each other. So that means I may need to have the client take certain medications during the day. And then this other medication you would have to take at night because of interference. Okay. Because of drug dependency, sometimes people, will try faster ways to feel that feeling that they want to get. Okay. For example, you can take some medications by mouth. Okay. Taking medications by mouth, you can develop a dependency if you abuse that drug, if you abuse that medication, but it might take a little while longer for you to feel the effect because you took it by mouth. Now, what if I say, you know what? I don't have time to wait for this medication to kick in. I need to feel it now. I need it now. So now, instead of taking stuff by mouth, what do you guys think the person would do to feel that effect quicker? What route would they give themselves that medication to get that high quicker? IV, exactly. Thank you, Ebony. So now we're talking about intravenous drug usage. Okay. And we all know when, if you don't have control of your mind, you're not thinking about consequences. You're not thinking of, let me wash my hands first before I eat because I don't want to get sick. You just thinking about getting your hands on a drug. So you're not thinking about, you know what, maybe I should use my own needle that I've only used because I know it's safe. You just saying, let me get my hands on something so I can get this high, which means what if you're sharing a needle with somebody else? Okay. You're not considering, does that person have HIV? You're not thinking, does that person have AIDS? You're not thinking about none of that. The consequences have left the building. I'm just thinking of getting high. That's an addiction. That places you at risk for developing HIV and AIDS or even hepatitis. Okay. So that is what we mean by comorbid conditions. They can definitely make treating drug dependency a little harder, or the person could be more at risk for developing a drug dependency because they have a comorbid condition. So that is our first section, the general information. It is 9:40 approximately. Let's take a 10-minute breather. You guys doing great so far. Let's take a 10-minute breather. So 9:50. And then we will come back and we will talk about the drugs that we see more than likely if a person has developed a drug dependency. So 9:50, you guys will be back.
Okay. Can you go back to the slide, Professor, before we go on break?
Sure. What slide?
The one you just moved from.
There you go. So I'll leave it here while we're on break.
Yes.
Ito guys, pero nakaribon dito na ano, kulay fuchsia. Dugo.
Okay, you guys, we are back. So I see in the chat, there's a couple of conversations going on. For those of you who are interested in learning about Naxlex packages and what the site offers, there has been a posting in the chat. Just a quick review. Naxlex offers over 3,500 NCLEX style questions. They are divided into different types of activities that you benefit from. They have CATs, which are tutored, review questions as you answer them, RATs, which are readiness assessment tests that tells you how, you're preparing for the NCLEX, how ready you are. Those are tests where you complete the whole entire test, and then you get to see how well you've done. You get to see answers, you get to see the rationales. Okay. Now, the good thing is you can try Naxlex for 2 weeks for free, and then you can choose a package, either 30 days or a 90-day package. My advice, and I'm always, talking to students about NCLEX prep because I have worked with students for preparing for the NCLEX. You definitely want to have a subscription service that gives you a lot of questions to practice, because that is how you ultimately will prepare for your NCLEX. Students ask all the time, how should I prepare for the NCLEX? How do I study for the NCLEX? Honestly, there is no right answer. There is no blueprint to tell you how to exactly study for the NCLEX, because the NCLEX is a self-adaptive test. Okay. The NCLEX is going to be based off of how you answer your questions. So, how you answer the question will determine the next type of question you get. And that can be from any category. So, it's hard to tell you, you need to do a little bit studying more for med surg, do a little bit more studying in pediatrics and maternity. We can't tell you that because we literally have no idea where those questions are going to come from in terms of subjects. But what we do know is that you're going to get a variety of questions in different areas. Okay. And so you just need to be prepared for questions. You need to be, oh, thank you guys. I did not know the camera was off. Thank you. Number 143977. Thank you very much. So, again, you just want to be prepared for whatever question is thrown at you. You're not going to know everything, and that is okay. Okay. You should, know how to critically think at least, and improve your chances of getting a question correct. And that is what NOCLEX is moving into the direction of, not just giving you a bunch of questions, again, over 3,500 to practice, which is a lot more than enough, but showing you how to test take. Talk about, prioritization strategies, Maslow's, ABCs, the MAR method. Those are a lot, the Kaplan decision tree. Those are a lot of things that's going to help you guys with taking the NCLEX when you come across the question that you really just have no idea what the answer is, or you're stuck between two answers. Because let's be honest, how many times does that happen when you've taken a test, you're looking at two answers and you saying to yourself, both of these look like they could be right, but we know that's not that's not the case at all. One is wrong and one is exactly. So you definitely want a service that's going to help improve your test taking. You want a service that's going to give you more than enough to practice your test taking. Okay. So again, you guys can look into the chat and see the breakdown of what is offered, but I would definitely suggest that you get a package that's going to give you questions to answer. Okay. And depending on how soon you plan on taking your NCLEX, you may only need a 30-day package, or you may benefit from a 90-day, because sometimes you just push a date back because you're really not as ready as you thought you were, which is okay. I think I pushed my date back like 2 or 3 times before I actually said, okay, I'm not pushing it back no more. I'm going to actually take it. So do not feel bad if you set a date and then you pushed it back. So now let's get into the different types of drugs or medications we see that are likely to cause dependency. So these are our categories: CNS depressants, opioids, hallucinogens, inhalants, and lastly, marijuana. Yes, marijuana is natural. It comes from the earth. However, it can definitely cause a dependency depending on how it is taken. So first up, let's talk about CNS depressants. Now, typically when we prescribe someone a CNS depressant, okay, they have a mental health disorder, something like depression, anxiety, or maybe a phobia. type disorder. And one thing we know about the CNS depressants, they may take a while before they start working. And we've talked about this a lot in my prior webinars. You got to make sure people understand. Listen, it may take about 4 to 6 weeks for you to feel the effect of this drug. So please stay compliant and take the medication as prescribed. So even though it takes a little bit of time to work, most people will find, listen, these drugs really do work. I do feel a lot better. So because they work so well, okay, people are more likely to be compliant once they do start kicking in and they feel the benefits. However, you have some individuals, when it comes to a CNS depressant, it works in the beginning, but then all of a sudden they're going to notice that it is not working as well as it once worked. And what's going to happen is the person may think, you know what, maybe I need more of the medication to get the desired effect that I used to get. So that is going to lead to the potential of developing dependency. You've already been taking it for an extended period of time, and now you're just going to add more because you're no longer feeling the effect that you used to feel. So what happens is, if you miss a dose of your CNS depressant, you're going to start feeling withdrawal syndromes. Now, again, it is very easy to develop a dependency because you have to take CNS depressants in most cases for an extended period of time. So that is why it's very easy to develop a tolerance, or develop a dependency, a tolerance, even an addiction. So what happens is you miss a dose and you start feeling funny. Okay, those are your withdrawal symptoms. So what happens is you have to keep taking the medication. You cannot just stop it abruptly. And if a person does not know how to get the right help to wean themselves off a CNS depressant, they definitely will develop dependencies. Some people, they will stay on antidepressants even when they don't need them because they have developed a drug dependency. Again, a lot of people know for a fact they do not need medications. However, because of the withdrawal symptoms, they decide to still take them. It is easier to just take the medication than to work through withdrawal. And a lot of people will tell you that is just how they feel. So they're taking medications such as CNS depressants that they absolutely do not need, but they just do not want to deal with what comes with withdrawal because of their drug dependency. Benzodiazepines, one of the highest risk for developing drug dependency. Okay, so please keep that in mind. When it comes to CNS depressants that are the most likely to cause drug dependency, benzodiazepines will be up there at the top of the list. And benzos are a first line medication for a lot of mental health disorders as well as physical disorders such as seizures. Okay. Next, you have opioids, and everybody are familiar with opioids. They are controlled substances prescribed for pain relief. Okay, and a lot of times we prescribe opioids for that tough pain, that fresh out of surgery pain, chronic pain, cancer pain. Those of you who have had kids, and we know what that is, that type of pain. Listen, you see opioids everywhere. General anesthesia. Opioids are used in a lot of different ways. If they are taken as prescribed and they are prescribed responsibly, you are not going to have a high risk for developing dependency. I'm going to say that again. If an opioid is prescribed responsibly, it is prescribed, not the maximum dose. You're prescribing just enough to give the client the desired pain relief that they need, and the client follows directions. It is very hard to develop a dependency to opioids. Okay. What starts to happen is if you are taking an opioid for an extended period of time, that is when the risk for dependency happens, just like with the other medication we just talked about. Because typically, when it comes to opioids, we will prescribe them for the beginning time period. And then we'll say, okay, after this, you're not getting another prescription, but I want you to start using Tylenol. I want you to start using Motrin. Because what's supposed to happen is your pain is supposed to get less and less, severe, so that you don't need something like a controlled substance like an opioid, like morphine, for example. But however, nonetheless, you can still develop a dependency, both to the legal stuff and to the illegal stuff. So when it comes to prescription medications, again, for the nurse taking care of this client, keep in mind with prolonged use, there is an increased risk for dependency. Now, when it comes to illegal drugs, Okay, illegal drugs are very prone to misuse. They are not prescribed under the guidance of a healthcare provider. And that is the purpose of the healthcare provider, to follow up, to see how you're doing, to see how the medication is working, to measure levels of the medication in your blood, to say, you know what, we need to lower the dose, or the dose appears to be just fine. When you have an illegal substance, you're just taking it. There is no guidelines, there's no orders, there's no directions. I'm just taking it. And I'm taking it and I'm taking it and I'm feeling good. So I'm gonna keep taking it, and nobody's monitoring me, nobody's watching me, nobody's saying, hey, you appear to be maybe developing a tolerance, or hey, you appear to possibly developing a dependency and addiction. There's nobody over your shoulder looking out for you that way when you're taking an illegal drug. So it is very easy for you to take an illegal opioid for an extended period of time and become dependent. Okay. For a lot of people, if they have taken an opioid for a chronic time period, they will possibly develop withdrawal symptoms, dependency. So that is why we don't like to use opioids for chronic management of pain. Now, there are some people where that's the only option you have. And I'll give you an example: cancer pain. A lot of clients that I've dealt with that have had cancer, they all pretty much say the same thing. Cancer pain is a different type of pain. It can be hard to treat. You gotta try a bunch of different combinations and dosaging to try to get this client's pain under control. Not clear it completely, because a lot of people have a disillusion or an unrealistic view of how pain medication should work. In some cases, we're not going to be able to get rid of all of your pain. We just want your pain to get to a point to where it's tolerable, to where you can still function, but you have minimum discomfort. So some people will continue to take opioids and take them, then take them and take them, and they develop a dependency. But remember, we typically do not like to prescribe opioids for chronic pain relief unless it's just a last resort option. Then you have hallucinogens. So these are the drugs that are going to have, your brain altered. You're going to see things, you're going to hear things that aren't there. Drugs like mushrooms. Okay. And listen, mushrooms go back. The use of mushrooms go way back. I know everybody probably heard of Woodstock. If you hadn't heard of Woodstock, look it up. You'll know exactly what I'm talking about when I say mushrooms has been around for a long time. So, you take a medication like a mushroom, and all of a sudden, from what I've been told, what it does, I've heard people say, the trees were singing, or the colors were more vibrant. They sitting outside in the backyard and looking at the sky, and the clouds are turning into hearts, and they turning into puppies, and whatever. The grass is like a real green, not like the regular green. It's like real green. You hear music, you feel good. It's love, it's light, it's peace. You feel awesome. That is what an hallucinogen. Listen, who don't want to feel like that? Understandable how people take hallucinogens and they become, dependent, or they become addicted. It feels good. And because you think you are seeing or hearing things, if it's a good feeling, you want to get more of it. You want to feel more like that. So, of course, you're going to use more and more of the hallucinogen. Now, most hallucinogens are not considered to be chemically able to cause dependency or addiction. Most. However, there are two types that if you do abuse them, okay, you definitely have a chance of developing a dependency. That would be PCP and LSD. Okay, PCP and LSD, probably one of the oldest hallucinogens on the market. And anyone who's taken them will definitely tell you that they've had hallucinations, they've had very wild, vivid dreams. And again, those are feelings that people want to have more of. So that's where the risk for the dependency comes in. Over time, with usage of hallucinogens, you become more relaxed. That's another feeling that people are trying to get more of. Some people, listen, I have a hard time sleeping at night. I don't care. I can drink chamomile. I'm not saying me in particular. I'm just saying a person. I can take hot showers. I could drink all the warm milk before bed. I can even take a sleeping pill. I still have trouble sleeping. I need something strong to help me sleep. Okay. If you guys remember the artist Michael Jackson, one of the things that he used to say was that he had trouble sleeping, that he never slept. And that is one of the things that led him to use powerful tranquilizers to help him go to sleep, which is one of the reasons they're saying he had a heart attack. It's the same thing with these people. I have trouble sleeping. I need something strong. I need something potent. So I'm probably going to turn to a hallucinogen that's going to relax me over time. Okay. With hallucinogens, it becomes compulsive. You have to have it. Your mind can't think of nothing else but that feeling, that floating feeling. I've had some people say they felt like they was floating. They felt like they was flying. Their body, their soul left their body and they was flying all over the place. People want to feel like that. They like feeling like that. And so it becomes compulsive. I have to have it. Okay. Not necessarily associated with physiological or physical dependency. Okay. It is more associated with a psychological dependency since it is a mind altering drug. Okay. The next type of medications that can cause a dependency, inhalants. Now, a lot of times you don't hear a lot of talk about inhalants, but it's real. Okay. And a lot of young people engage in inhalants because it is easier for them to get their hands on these types of substances than it is to get their hands on other types of drugs. Okay. You can buy something over the counter and turn it into an inhalant. Okay. So, chemicals that are found in everyday household products, people are using them to get that high euphoric feeling. Okay. And what they do is they sniff, they huff, they snort. Those are terms you may, hear when we're referring to how people utilize inhalants. Huffing is probably one of the more common terms that you hear, but each one of those terms are related to a person, smelling or using an inhalant. So they are inhaling the fumes, they are inhaling the chemical, and that is what is going to give them that high feeling. Okay. Now, here's the issue with inhalants. The feeling that you feel, that high that you get, it does not last long. It lasts for only a couple of minutes. And because it only lasts for a couple of minutes, so I felt good for a little while. You know what? I want to feel like that again. Let me huff again. And you're going to keep huffing and keep snorting and keep sniffing because it only lasts for a couple of minutes. And I want to have this continuous feeling across the board. Okay, so that is where the risk for dependency comes. Because the feeling lasts for a short time, I'm going to keep using it back to back to back to back. Now, if you are an individual that have used inhalants over an extended period of time, it will eventually, okay, change or alter the way your brain works. You can go into a withdrawal if you've used it long enough. Now, think about it. For something that has an effect that does not last for a long period of time, if a person does develop a dependency, they have been abusing this particular item because, again, this does not last long. So that means the effect leaves your body quickly. So if you're using it often, if you're using it multiple times a day, you definitely can develop a dependency. You can also develop an addiction because your brain chemistry is altered. Oh, sorry. Next up is the medication, marijuana. Now the jury is out on marijuana. You have some people that do not feel that marijuana is addictive, that marijuana, doesn't cause all the issues that people say that it cause, it's natural, it's from the ground, which is true. However, you have to keep in mind, it is not the medication itself that is the problem. It is the people that are using the medication. It is a gateway drug. Exactly. People are, guns are bad, guns are this. Listen, guns don't go off by themselves. It's people that use the guns, it's people that have the guns. It's the same thing like marijuana and these other drugs. Marijuana is natural, it is from the earth. How could this be illegal? Because people abuse it. People become dependent on it. And then there comes the issues with using marijuana. It is another mind altering drug. It stimulates feelings of relaxedness. It stimulates a euphoria, a high. It's like, marijuana is like hallucinogen. You just don't have, seeing things that aren't there. You typically don't hear things that aren't there either. When you regularly use marijuana, meaning you like an everyday smoker, okay, that is where the risk for the dependency comes. Okay. For some people, the use becomes uncontrollable, meaning the compulsion sets in. It starts to impact your normal everyday functioning. You have some people, they cannot make it. They smoke every day. I remember I had students who I was pretty sure was getting high every day. It's like every time they came in my class, I could smell it. But as a professor, when it comes to drug usage, of course we advocate against it, but honestly, outside of the classroom, what power, what control do I have? I had one student that admitted it made him smarter. I've never heard of that. It was only one person, one student told me literally that marijuana helps them feel smarter. They do better on their tests when they're high. And I'm saying to myself, that would normally be the exact opposite of what I would think you would feel. You're able to study more, you're able to focus more because marijuana is supposed to relax you. But this person says, listen, it helps me study. That's the only time I smoke, when I come to class and when I have to take a test. I said, okay. I mean, I don't think that's how it goes, but if that's what the person says it is what it is. But for most people, it does not have that effect. And again, the usage can become compulsive. That is when the physiological turns into a psychological. You have to have it. It is a compulsion. Now I'm having trouble at work. I'm having trouble in my relationships. I'm struggling as a parent because I'm dropping the ball on my parenting. When you use marijuana frequently, you can develop physiological dependence, but again, you can also develop psychological dependence. It can turn into withdrawal. Marijuana can cause withdrawal symptoms, absolutely, if you abuse it. And then it can go into addiction. Yes, something natural, something from the earth can cause an addiction if you misuse it and you misuse it. Okay. So now we come to the next break. We are making great time. So it is 10:15. Okay. Let's say 10:25. And then we will run through the last portion and then we'll jump right into our NCLEX questions. Okay. So again, 10:25. We'll be back. Okay, you guys, let's finish up. We're going to finish this last section and then we're going to jump into our NCLEX review questions. So now we're going to talk about, recognize.
This is going to separate before their gestational age, before they get to term. It can occur at any time. Yeah.
Okay, I thought it was a question. Okay, so I just muted that person just in case. I don't think they were talking to me. So let's go into recognizing drug dependency. Okay. Oh, look like somebody wrote. Give me a second, you guys. Let me see if I can erase this. I'm getting better with this. Perfect. So, risk factors for drug dependency. So, we look at genetics. Okay. If there's a history of drug abuse, drug addiction in a family of any type, then there's a risk for an individual. The environment that the person lives in. Okay. If there is easy access to medications, remember, there are some places it is very easy to get your hands on opioids. They call them, oh gosh, I forgot what they call them. It's a name. But, you can walk into a clinic and say, listen, I got chronic back pain. I got this type of pain. I got that type of pain. And they're really not doing thorough backgrounds. Let me see some records. Let me see some documents. It's like, okay, here goes a prescription. And the next thing you know, you have your hands on Percocets or any other type of opioid that you really did not need. So, environment, easy access. Okay. Dual diagnoses. Remember, a lot of mental health conditions coexist, a lot of physical ailments coexist, cancer. Okay. Again, kidney disorders, anything, brain disorders. People are just, sick of being sick and they turn to, drugs or abusing medications because they don't know how to effectively cope any other way. Early usage. If you started using drugs and other substances at an earlier age, your chances of developing dependency increases. The method of use. Okay. Yes, you can take same drugs different types of ways. You can take stuff orally, you can inhale, you can inject. So a lot of times when people use injection routes, that is a quicker way for you to feel the effect of an actual drug, versus smoking versus inhaling. So if you are the type that is an intravenous drug user, definitely you have a higher chance of developing dependency. And lastly, again, a coexisting mental illness, which plays into the dual diagnoses. So this is just focusing on mental health. And definitely mental health disturbances play a huge role, okay, in the development of a drug dependency. So when we diagnose drug dependencies, now this is not, a test that we can definitively measure if a person is dependent on drugs or not. It's not like I can measure your blood pressure or I can give you blood work. Now, if I can give you blood work, I might find the medication in your system, but what if you used the drug yesterday? So that's why the drug shows up in your blood work. So it's not like, I could just give a magical test to tell me definitively measuring if a person is dependent. So a lot of the ways we diagnose depends on what comes from the client themselves, which goes back to the saying, until a person realizes that they need help, until they acknowledge that they need help, treatment is not going to, typically work. So we do a physical assessment. Okay. We do vitals, we do blood work, we do other things. We, may give you an EKG, an ECG, an EEG. Okay. We might look at your kidneys because we know how certain medications affect kidneys. We might look at your liver. So we're going to give you a physical assessment. We're going to do labs. Then we're also going to do a mental health assessment. Okay. Are you suffering from depression? Are you suffering from anxiety? Do you have mood disorders? Okay. Are you feeling, that you're out of control? Do you feel compulsed to use certain things? Do you have any way to effectively cope? Is this the only way you know how to cope when certain things are going on in your life? These are all the things we look at. Have you dealt with depression or any other type of, condition that can increase your risk for drug dependency? Have you suffered from it in the past? Okay. Are you being properly treated for an existing mental health condition? So we do a thorough mental health assessment because that is also going to help us to pinpoint what exactly is going on with the client. And lastly, a personal history. Okay. We want to know, have you been dealing with, you know, anything that is causing distress in your life? How's your finances? Have you had trouble with finances in the past? How have your relationships been in the past? A lot of times, personal history is a big catalyst for drug dependency. Okay. Some people just have a hard life, a hard life. I don't know if you guys are up to date on, you know, movies that are out, not necessarily a movie like in theaters, but if you guys watch Netflix, there's a little mini movie that Tyler Perry put out. It's called Straw, and it centers around mental health. I'm not going to tell you what it is because I don't want to ruin it, but you can definitely see how the lead character, which is Taraji Henson, you can definitely see, based on what she has going on, how it's very easy for a person like her to turn to drugs to cope with what's going on in her life. So a lot of times we look at your history. You know, if you're currently struggling, we try to set you up with resources that's going to help alleviate some of the stress. Listen, stress is a powerful thing. Not only can stress kill you, it can drive you to do certain things that you normally would not do. Oh, it's called Straw. Let me type it in the chat. It's called Straw. Um for some people it was a little emotional to watch, but like I said, some people can definitely relate to it, and you can really see how, like I said, the main character could go down that road of dependency. Okay, for anybody. Oh, yes, Ebony. So you know what I'm talking about. Listen, it was in my opinion, it was well written, well played. Treating drug dependency. So just like we treat addiction, just like we treat, you know, withdrawal, it's all pretty much the same. Okay. Counseling. The goal is to kind of help the person, you know, better effective ways to cope. Okay. Other things that you can do versus turning to, you know, abusing drugs or abusing medications, you know, to help you. Group therapy. Sometimes it's good to be in a group. You hear other people's, you know, perspectives, you hear other people's stories, you know, you realize, listen, I'm not by myself, somebody else gets it. And that can help motivate the person to slowly get off the medication. And then family therapy, you have to have a strong support system always when it comes to, you know, getting a person off a particular drug. Remember, this is not something that's going to happen overnight, because when you abruptly remove the symptoms, I mean, remove the medication, you get the withdrawal. So this person is going to have a strong family support, because there may be times that the person says, you know what, I can't do this. I need the medication. Give me my pills. And you have to have somebody in place that's going to say no, because it's going to be a tough journey. Sometimes those withdrawal symptoms are strong. And remember what I said, some people would rather take the medication, abuse the medication, than feel those symptoms of withdrawal. And then we can always detox you. Okay. We know that you're not going to come off the dependency overnight. So little by little, we have to get your body not used to the medication, because that's what dependency is. Your body adapts. So little by little, we have to get your body to unadapt to the medication. So it is foreign, because when the medication is something familiar, that is when you have dependency. So we want the medication to be foreign to the body. We don't want the body to have a familiarity with with the medication. We want the body to say, you know what is this? This is new. That is how you know you don't have a dependency, that you haven't developed a tolerance. And then if you do stop taking the medication, you do not get those withdrawal symptoms. So, what exactly is drugs, substance, or withdrawal? Okay. And we talked about withdrawal. I don't know if it was last week or the week before last, but let's just quickly go over it again. So, when you stop taking a drug or a medication that you have been taking for a chronically, extended period of time, if you stop it abruptly, you may experience some symptoms that are very unpleasant. Okay. Again, it typically starts like a headache, then it goes into nausea, vomiting, and other GI disturbances. Those are called withdrawal symptoms. And withdrawal symptoms is a reason why a lot of people are not successful with their attempts to stop using drugs or stop abusing certain medications. Because again, the withdrawal symptoms are so severe that they would rather use the medication or abuse the medication and use the drug versus go through the withdrawal process. Um, depending on your dependency. Oh, let me mute. Depending on your dependency, your withdrawal symptoms can be severe or they can be mild. Okay. Some people withdrawal can turn into seizures. That is how dependent they are on whatever substance that they have the dependency or the addiction to. They can go into depression, respiratory issues, the whole nine. Okay. If you have developed a dependency, you are going through withdrawal because your body is going to have time to readjust to life without access or taking this medication or drug. So you're basically retraining your brain, which is why it doesn't happen overnight. And lastly, we will wean you little by little. That is called detoxing. A lot of people that have developed a dependency or an addiction, they have to be detoxed. Now, there are people that have stopped cold turkey. Not everybody is able to do that, especially if you have very severe withdrawal symptoms. But some people will stop cold turkey, deal with the withdrawal symptoms for a day or so, and they've stopped. Again, not all people are able to do that. Some people withdrawal symptoms last longer than others. So if you're trying to just quit cold turkey, some people are successful and some aren't. We feel that it's better to go through this process under a trained professional because, again, instead of just making you, completely stop access to this particular medication or drug, there are alternatives that will trick your body into thinking it is still using the substance, and we just give you little by little over time until you are no longer taking this medication, and hopefully your withdrawal symptoms have passed. There is no way to determine how long a person will experience withdrawal because everybody's, their body responds differently. But again, it's just a group of unpleasant symptoms you may feel or experience if you stop abruptly taking a drug or a medication that you have been using for an extended period of time. So, as a nurse, how do I manage a client with drug dependency? So, my job is very, very important. Okay. I need to assess the client, one, to determine what type of dependency do I have? Do I have a physical dependency? Do I have a psychological dependency? Am I looking at addiction? Has my client developed tolerance? Again, tolerance is when your dosage is no longer working. It is not working like it used to because your body has adapted. So, am I looking at tolerance, which can develop into dependency or addiction? I have to provide support, whether that be individual support, whether that be exposing the client to group support, rehabilitation services. I'm going to put together a plan of care focused on the client and their needs. Everybody is different. So, a plan of care to help a client that is, drug dependent, it is going to be client specific based on their particular needs. And a lot of times it focuses on what is the catalyst for the client using or abusing a particular drug. If you have chronic pain that just does not seem to get better, no matter what you take, understandable, that can lead to dependency. Okay, let's explore some other options to help you. If you are dealing with a resource situation, okay, let's see if there's any resources available to help you. So my job is to kind of explore the alternative options to help my client. Okay. I need to make sure if I am dealing with a client dependency, I need to watch for withdrawal symptoms because we know withdrawal symptoms can be very severe. They can be dangerous. Again, the client can start having seizures when they go into withdrawal, and they can, they can die if it is not managed appropriately. And then, of course, I need to refer for psychological services, cognitive therapy, individual therapy. Maybe they need other antipsychotic medications. Okay. So it's like my job is just to be like the facilitator. I'm like the quarterback. Okay. I put the client and, I put the ball in a place where the client can get it and they can score or get the help that they need. So that is what the nurse is when it comes to this type of a situation, because you're the one that's keeping the eye on the client for the most extended period of time. And that is the end of our presentation on
Can they get CBT for that drug too, Professor?
They absolutely can. Remember, cognitive behavior therapy, that is just a therapy to kind of alter the way the brain works. That's it. It's just to get you to consider, a perspective that you normally wouldn't consider. Just trying to reprogram your brain. And we use positive reinforcement to make cognitive behavior therapy, stick. So we focus on the good things when your brain or when your mind thinks a different type of way, and there's a positive, safe reward. We're going to put emphasis on that and train the brain to think more in that way. Okay, so that is what CBT is, and it can work, it could be used for anything, especially mental health. Okay, you can use cognitive behavior therapy as a nursing student, honestly. If you are not doing well in school, you're not passing your test, and you're trying to figure out, why can I not pass this test? I have studied, I have did this, I have did that, but I'm still not getting the results that I want. You can try a form of cognitive behavior therapy to retrain how your brain thinks. Retraining how your brain thinks could improve your studying, can get you to look at a test question and see things you probably wouldn't have thought to think about before. Okay, so you could definitely use CBT with any type of therapy when you're trying to improve something. Okay, so let me share my screen again. So we're going to go right into our NCLEX questions. So give me a second, you guys. I am sharing. Any questions so far? While I do check the chat, you guys. So again, if you have any questions, definitely feel free to type into the chat, or again, just unmute yourself and jump right into the conversation. Um, Actually, before I start, let me post the give me a second, guys. I'm gonna go ahead and post that link first for your webinar review so I do not forget. Okay, so for those of you, you guys know, if you've joined in a webinar before, we always will ask you to type, send in your reviews. How did the webinar go? Things you like, things you want to see more of. I just posted in the chat. Okay, so you guys can click on that link and give your feedback. Now I'm going to share my screen again for our NCLEX review. And remember, you guys that are studying for the NCLEX, a lot of times in my webinars, I get students that are testing soon, or students that are about to start the process of preparing for testing. Remember, please make sure you have a strong package system that gives you practice to NCLEX questions, because that is ultimately how you are going to prepare for your NCLEX. Okay, you want to answer about 50 to 100 questions a day. I have students that do 200 questions a day. I know that might not be feasible for everybody, because you have life, you got work, you got jobs, you got kids. So you might not have the ability to commit to 200 questions a day. But as long as you're doing about 50, 75, 100 questions a day, and do that every day if you can, you will be able to properly prepare for the NCLEX. Okay. So now let's get into our NCLEX questions. So first question, which drugs may be more likely to be abused because of tolerance and physiologic dependence? A, lithium and davoporx. B, verapamil, chlorpromazine. C, alprazolam and phenobarbital. D, clozapine and amitriptyline hydrochloride. So to answer this question, okay, you guys need to know your classification of drugs. So this is a pharmacology question. There will be a small percentage of pharmacology questions on the NCLEX. This is just straight pharmacology knowledge. So let's see what's in the chat. I see a lot of C's. I see a lot of C's. Absolutely. The correct answer is C. Good job. Okay, it's very important to know your pharmacological questions, to know your drugs, because you do get questions about drugs and side effects and what is important to educate the client about regarding a certain drug that they are taking on the NCLEX. So those drugs are benzos. Okay, and we said in the presentation, benzodiazepines, one of the easiest drugs.
I'm sorry, can I see the question one more time?
Yes, you absolutely can. I'm going to go back. So remember what we said, benzodiazepines are the easiest CNS depressant drug to become dependent on. Okay, that is why it is so important for us as nurses to educate the client properly A lot of times the issues that we see are non-compliant. The client is not taking the medication like they're supposed to. They have an unrealistic expectation of the medication, or they just don't have the knowledge of what the medication is supposed to do. Okay, so class answer C, choice C are your benzodiazepines. Can we get so when you guys go to previous webinars, okay, you can download the presentation and it will include the slide with the questions. Okay, because the only thing that I uploaded that I'm able to upload, because there's only one slot for uploading, would be the presentation itself. But if you go back to previous webinars, you'll see all of these questions and you can get it that way. Okay, so question number 2. A client with a diagnosis of alcohol intoxication and suspected alcohol dependence is admitted to the psychiatric unit. Other assessment findings include an enlarged liver, jaundice, lethargy, and rambling, incoherent speech. No other information about the client is available. After the nurse completes the initial assessment, what should the priority action be? A, instituting seizure precautions, obtaining vital signs frequently, and recording fluid intake and output. B, checking the client's medical records for health history information. C, attempting to contact family to obtain more information about the client. D, restricting fluids and leaving the client alone to sleep off the episode. So, a lot of answers. Let me see what we got. Okay, looks like we're all in agreement. Absolutely, the correct answer is A. So this was a priority question. Okay, you're definitely going to see some priority questions, delegation questions on the NCLEX. Now, remember, when it comes to answering a prioritization question, you are not saying that the other answer options are not important. You're not saying that the nurse doesn't have to do the other options. Priority is asking, before you do anything else, what is the first thing that I should do? Now, just going back to the question, okay, if you guys was with me for alcohol misuse, you know that when a client has dependency on alcohol and they go through withdrawal, they are at risk for having seizures. Okay, the sudden takeaway of alcohol can induce seizures. Yes, we know it can definitely harm the liver, but one of those things we don't really think about the risk for seizures. So it is very important. Safety, absolutely. Very important for the nurse to implement seizure precautions because that is a safety concern. Get your set of vitals. And then, of course, fluid intake and output because the client is having liver issues. Okay. The kidneys may also be affected. So eventually there's some blood work that's going to be taken to kind of see what's going on with the client. Now, you can check medical records. You can attempt to find out who this client is there family we can contact, or we can possibly restrict fluids, but we do not leave the client alone. Remember safety. But it is very important to think immediately what is the client's needs. That is your priority. Okay, so that's why A would be the correct answer. Question number 3. A nurse is caring for a client who states, I don't want to keep smoking, but every time I quit, I have all these terrible symptoms. Which responses by the nurse are most appropriate, recognizing the client may have developed alcohol dependence? Select all that apply. A, there are options for replacement therapy that has been shown to help manage withdrawal symptoms. B, have you experienced issues with sleep, such as difficulty falling asleep when you quit in the past? C, would you be open to learning about other strategies for managing anxiety? D, you may lose a lot of weight once you stop smoking. So we will have to monitor your eating habits. E, if you have smoked for less than 10 years, withdrawal cravings are usually minor. So again, remember, even though we talked about drug dependency, we do know that a lot of substances can be addictive, can cause dependency, alcohol, caffeine. So let's see what your answers are. I see ABCs, I see AC, BC, BA. Okay, so it seems like you guys are kind of sort of in agreement. Okay, I do see again AB, ABCs. So let's look at what our correct answer options are. The correct options are ABC. Good job. Comfort, you just came in and you put E. So let's talk about why These answers are correct. I'm going to go back. So A is definitely a statement that I would make to the client. Okay. Remember, the part about treating a client with dependency is to help them wean off the drug or the substance. We want the body to no longer be adapted because that's what dependency is. So the goal is to unadapt the body, get the brain not used to the medication, get the body not used to the medication. So there are replacements. When we put a person through detox, okay, we do not stop their exposure cold turkey. We give them something that is going to mimic the effect that they're used to feeling, and we're going to give them little by little at a time until we are no longer giving them the substance at all and their body is no longer experiencing withdrawal. So A is definitely an option. B, have you experienced issues with sleep, such as difficulty falling asleep when you quit in the past? This is to develop the type of dependency the client has. Remember, mild, moderate, severe. And when you do stop access to this particular drug or substance, what type of withdrawal symptoms are you expected to have? That depends on how dependent on the drug you are. So we want to know about your sleeping habits. Okay. C, would you be open to learning about other strategies for managing anxiety? Absolutely. Effective coping skills. Remember what we said, a lot of people turn to, abusing prescription medications because they don't know how to effectively cope with whatever it is going on. A lot of people will say they have pain that they don't really have just to get their hands on a controlled substance such as an opioid because it helps, to kind of take their mind off of whatever they have going on that's causing them stress. D is not the answer because it's the exact opposite. Okay. When you stop your dependency or when you stop exposing yourself, especially something like smoking, you're likely to gain weight. A lot of times dependency can affect the appetite, unless it's like marijuana. But for most substances, you don't have an appetite. You just going, you just all over the place. You're just going, going, going. You ain't got time to eat. You ain't got time to drink. So you possibly will lose weight when it comes to, drug dependency and going through that withdrawal process. E, if you have smoked less than 10 years, withdrawal cravings are usually minor. Remember, we're talking about chronic usage. That is how dependency, develops. It's hard to say 10 years it cause minor symptoms. Everybody is different. Chronic usage is chronic usage, and 10 years is a long time. So to say that 10 years you're going to have minor symptoms, that is highly incorrect and highly inappropriate. If anything, you would have mild, moderate to severe, withdrawal symptoms if you've been smoking for that long and you've been smoking considerably a lot for that long period of time. Okay, so that is why the answers are A, B, and C. Question number 4. A nurse is caring for a client who is experiencing alcohol withdrawal due to a development of dependency. Which statement best indicates that the client understands the need for long-term treatment? Okay, A, I will make an appointment with an addiction counselor for support. B, I will invite my family to join me in psychotherapy. C, I plan to attend Alcoholics Anonymous meetings regularly. D, I will begin with inpatient treatment and participate in an aftercare program. So this question is kind of assessing, does the client understand that even with treatment for dependency, it is not a guarantee that you will not have a relapse. Relapses are very common in people that have developed drug dependencies, and that's what we try to prevent. Something can happen, something can pop up, it can exacerbate your stress, and then the next thing you know, you have a relapse and you have started back taking that medication or abusing that medication or abusing that substance that you gained the dependency on in the first place. So our job, okay, is to determine, do you know or do you have access to what it takes to be successful in the long term? And it appears that everybody is on the same page. Yes, the correct answer is D, committing to an inpatient treatment center and an aftercare program. There is no time frame or how long you need to be in a treatment program, as long as you are getting substantially, sustaining results. We don't want you to just be okay right now, a week from now, 2 weeks from now, 3 weeks from now, a month, 2 months, 3 months. We want you to still be okay. We want, if something pops up and you find yourself, under stress, I'm not going to turn to this, popping pills to feel better or to take my mind. I'm going to find other ways to effectively cope. So it is very important to have a long-term strategies for success when you are dealing with a client that has developed a drug dependency. 5, a nurse is caring for a client during barbiturate therapy. The client receiving this drug should be evaluated for which condition? Okay. Client is taking barbiturates, so you already should know what's going on with that. A, prolonged bleeding time. B, poor drug absorption. C, physical dependence. D, hepatotoxicity. So if I have a client taking a benzo, what do I need to monitor this client for? So I'm seeing D's, I'm seeing C's. Looks like a mix between D and C. Good back and forth. Okay, so the correct answer is C, drug dependence. Okay, so we've already talked about barbiturates, one of the easiest CNS depressants to have a dependency on. So you definitely have to provide good education and you definitely have to monitor the client on this medication. Now I'm going to go back to the answer options. I want to say a couple of you did pick D. Now here's the misconception. Barbiturates are, very easily handled by the liver. This is not a medication that will commonly damage the liver. A lot of medications are liver toxic. This is not one of them. It does not affect the bleeding time, which will be a liver issue. So I'm actually going to go back again. Answer A and answer D kind of are the same. Because if you have a problem with the liver, you can definitely see an increased risk for hemorrhaging. So no, okay, it doesn't affect the liver. It doesn't affect platelets. It doesn't affect clotting factors. So typically, hemorrhaging risk, liver issues, not necessarily something that I need to monitor this client for. Because again, barbiturates are absorbed very well by the body. Now, this as long as the client is following in orders for how to take the medication so they are compliant. Anytime you abuse, okay, a very highly addictive substance, a substance that can easily get you dependent on it, you definitely have the risk for other damage in other areas. But if you follow directions, you should have no issues with taking a barbiturate, but the client can develop a dependency. Question number 6. A client with pancreatic cancer has been receiving morphine via a subcutaneous pump for 2 weeks. The client is requiring an increased dose of morphine to manage their pain. How should the nurse document this finding? A, tolerating the medication well. B, showing addiction to morphine. C, developing a tolerance for the medication. D, experiencing physical dependence. Okay, so let me look in the chat. So I'm seeing a lot of C's, 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 a lot of C's. And we talked about this. The client is experiencing tolerance. Okay, so remember what tolerance is. You're going to need more of the medication to achieve desired effects. You are taking this particular dosage for a period of time. Now, all of a sudden, the medication doesn't appear to be working like it used to. My pain meds in the beginning, they worked just fine. I took the medication like I was supposed to. My pain came down to something that was tolerable or it disappeared altogether. Now I'm taking the medication again. Nothing has changed, but it feels like nothing is happening or my pain has gotten even worse. Yes, the client has developed tolerance. So again, you're going to have to increase the dose in order to get the desired effects. Now, that is not always the right thing to do because you have to consider the side effects and the consequences. But in theory, when it comes to managing tolerance, the only option that makes sense in theory would be to increase the dose to get the desired results because the body has developed tolerance to whatever dose the client was taking. Okay. Question number 7. The nurse is caring for an older client, adult client, experiencing depression and chronic pain. The client is requesting a prescription for an opioid pain medication, like the one prescribed for knee surgery 5 years ago. Understanding the potential for developing an opioid dependency, What education should the nurse provide for the client? Select all that apply. Okay. A, physical dependence can develop quickly with opioid medications. B, opioid use is appropriate in chronic pain accompanied by depression. C, opioid use is more appropriate for acute pain than chronic pain. D, opioid use increases the risk for cognitive impairment. E, treatment for depression can improve pain symptoms as well as the depression. So, key things to remember, and this is NCLEX testing strategies. You got to pull out of the question what is important, what you need to pay attention to answer the question. So, one, you have an older client. They are experiencing depression and chronic pain, which means they're going to be taking medications over an extended period of time. Okay. They are requesting opioids. So that means, what do I know about opioids and pain relief? When is an opioid appropriate? Was an opioid not appropriate? Okay. And basically just making sure the client understands what is important when it comes to managing pain, and you have a coexisting condition such as depression. So in the chat, I'm seeing I'm seeing BDE, ACE, A and C, B and D, A, B, C, E. Okay, so we kind of got a variety of answers. That's what I like to see. A variety. Good job. So I see you guys are looking at this from different perspectives, which is why you have different answers. Okay, so let's see who got it right. Oh, let me look into the chat again. ACD, ACD. The correct answers are ACDE. Okay, and I think, did I see that? ACD. I saw a lot of ACDs.
This is hard.
Listen, do not listen. It's supposed to be
Oh
hard.
my God.
Supposed to be hard. Let me tell you something. If somebody, I'm gonna give y'all a tip. If somebody ever said that nursing school was easy, the test was easy, easy, that's not the person you want to take care of you, because nothing is easy about this. Okay, even if you're the smartest person on the planet, nursing is not a textbook profession. It is all critical thinking. Okay, that is why you have to practice answering questions until you get the hang of it. You got to learn what to pull out of a question to answer it. Okay, so let's go back and look at our answer options and discuss why A, C, D, E. I got three. I would have. Let's see why our answers are A, C, D, E. Okay. So, A, physical dependence can develop quickly. Absolutely. Okay, absolutely. That is why, and I think I said this in the webinar. Normally, we prescribe Percocets or any other type of opioid, morphine, methadone. We prescribe that for like a short period of usage. Like, for example, you just had surgery, maybe a couple of days at the most. And then we're going to tell you no more for this prescription. Let's try, Tylenol. Let's try Motrin. Let's try a combination. Okay. Or the doctor may lower your dose versus raising. So, absolutely, A is a possibility. B, not an answer. Opioid use is an appropriate chronic pain. That is absolutely incorrect. We said we like to use opioids for acute pain management. When your person uses opioids for chronic pain management, they have a high chance of developing dependency. Now, I also said there are just some conditions you just can't help it. You have to prescribe something like an opioid because there's nothing else that is effective. Cancer pain is a great example. Cancer pain is very difficult to treat, especially when a client gets, in the more later stages. So therefore, something like a strong opioid would be the only option to make this client comfortable. But understanding that this client is going to be taking this opioid for an extended period of time, they definitely have a high chance for developing dependence. Okay. C, okay, appropriate use for acute pain than chronic pain. Let me see something right quick. Okay, I did put C. Sometimes I gotta always check and recheck my answers just to make sure. Absolutely, more acceptable for acute pain. Let me see in the chat. Got some questions. So, what do we use for chronic pain? So, again, it depends. It totally depends. Sometimes what we do is, I'm talking to Ebony. Do they spill? They can. And that's actually what I was just about to talk about. Omar, you kind of read my mind. Sometimes we do what is called adjuvant therapy. Adjuvant. Okay. ADJUVANT. Adjuvant therapy is kind of a way to protect the client from possibly developing dependency, addictions, tolerance, and so forth. What happens is, so we was prescribed a main drug, like a benzodiazepine, morphine, but we would also prescribe a drug that works with the morphine and works with the benzodiazepine to make that drug more effective. So, in a way, we don't have to prescribe such a high dose, even if it's within the limits for the client to take, because we know the risk, okay, respiratory depression, drug dependency. So, because we know the risk, okay, we're not going to give the client a high dose, even again if it's within the normal limits for their weight. Instead, we're going to give them a lower dose of, let's say, the barbiturate, but we're also going to prescribe, let's say, an anti-anxiety medication along with this particular barbiturate to make the barbiturate more effective. You can also use a benzodiazepine. You can also use a benzodiazepine as an adjuvant drug. Sometimes benzodiazepines make a medication more effective. So with adjuvant therapy, you can better manage chronic pain, less likely to cause dependency. But again, sometimes you don't have a choice. It is what it is. Sometimes chronic pain is hard to treat, and you just have to, prescribe that opioid at whatever dose that you're going to prescribe it, because nothing else is working for this client. And we want the client to be comfortable, especially in the later stages. Okay. Um, yes, opioid use increases the risk for cognitive impairment. That's why we tell you, do not operate heavy machinery. Don't drive no cars. Once you take this medication, hopefully you are home. You're probably gonna get sleepy, so you just need to be at home, safe, and take this medication. Treatment for depression can improve pain symptoms as well as depression. Absolutely. A lot of times we see if we treat underlying conditions, other issues can improve. Okay, so ACDE. Question number 8. The nurse evaluates a client's understanding of benzodiazepines. Which statement indicates the need for additional teaching about benzodiazepines, being that they are one of the highly most addictive and most often dependent drug CNS depressants? Very important that we educate the client properly. A, I can't drink alcohol while taking a diazepam. B, I can stop taking the diazepam anytime I want. C, diazepam can make me drowsy, so I shouldn't drive for a while. D, diazepam will help my tight muscles feel better. So let's see what we got in the chat. B, A, B. So I'm seeing a mix. B, A, B, A's. Okay, so let's see. So you guys are really back and forth. I see a C. Okay. A C coming from somewhere. So let's see what the answers is. The correct answer is, somewhere in the chat. I like to look at all the chat answers before I look. Okay, I see B's and A's again. Correct answer is B. Okay, B, 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 B. Let's go back and look. So good job, those of you who put B. So I saw a couple of A's. Now, this is why it's important to make sure you read the question thoroughly. Okay, the question is asking which statement indicates the need for further teaching. So that means which statement is incorrect. Okay, when you say a client needs additional teaching, or if the question asks you what statement means teaching is ineffective, that is saying that the client did not understand what it is that you taught them. And if the client doesn't understand what you taught them, it's a chance that they can, use the medication inappropriately and do not take care of themselves properly while taking the medication. A is correct. They cannot drink alcohol while taking diazepam. So if a client makes that statement, they understood the teaching. Remember, the question is looking for which statement indicates an additional need, which statements indicate the teaching was not understood. A is effective. A is correct. Okay. Now I saw a C. Diazepam can make me drowsy, so I shouldn't drive for a while. Absolutely. Benzodiazepines can make you sleepy. They can make you drowsy. That is why we said whenever it's a depressant, Remember, class of CNS depressant. Any medication that is a depressant is going to depress you. Okay. Very rarely will somebody take a depressant and have manic, side effects. It is going to depress you. Everything's going to slow down. Everything going in slow motion. So you definitely should not drive after you take a diazepam until the medication wears off. So C is a correct statement. The client understood teaching. Okay. So of course, B, wrong statement. I'm not really sure if it was replace Noah. I'm not sure. I know some places they are more fond of certain other medications just to research that talks about side effect. Okay. So it could be, I'm not really sure. But I would just, you can always Google and look up to see if there was any changes because some countries do give certain drugs and some don't. Okay. They would prescribe something else. And yes, D is also wrong. Um, sorry, D is also correct. Diazepam will help my tight muscles feel better. It is a relaxing medication. That's why you feel drowsy. So instead of tight muscles, they may relax. It helps you to fall asleep easier. So yes, getting drowsy, feeling sleepy, relaxing muscles, all appropriate. B, you cannot stop taking a benzodiazepine. Remember, if you have a client taking certain types of medications, you don't stop abruptly. You can start withdrawal symptoms, especially if you've been taking them for an extended period of time. Instead, we wean you. We give you little by little over time until you are no longer taking the medication. Okay, seizure drugs are like that also. You cannot abruptly stop seizure medications after you've been taking them for an extended period of time. Exactly, you taper off. Absolutely. Question number 9. An older adult client with advanced cancer has been receiving methadone for an extended period. Methadone for chronic pain control for an extended period. The nurse believes the client has developed a physical dependence to the medication. Which action should the nurse take when the client still reports pain after receiving regular doses of the analgesic? Okay, so older client, advanced cancer, chronic pain, methadone, opioid. What should the nurse do? If the client says, listen, this not working no more, because that's basically what's happening. A, notify the healthcare provider and recommend adding an additional medication to manage the client's chronic pain. B, ask the healthcare provider to increase the dose of the more, oh, that should have said methadone. I typed morphine. It could have been morphine. Morphine, methadone, they're kind of the same thing, chronic pain. C, withhold all opioids and notify the healthcare provider for an naloxone prescription. D, ask the healthcare provider to place the client in a rehabilitation program. So, what should I do regarding this client? A lot of A's, a lot of A's. Okay, let's see the correct answer. Yes, it is A. Good job. I think everybody got this one. Good job. Now I'm going to go back and let's discuss. So, first off, this client is an older client. They're taking an opioid. Methadone is a strong opioid. Okay. Morphine, I know I have morphine and C. This could have been morphine the client was taking. It could have been methadone, either or. This is an opioid that the client is taking. Chronic pain management. The client has advanced cancer, so that was a clue. Okay. We know that there is a risk with chronic usage to develop dependency. And we have to consider what options do we have? What is the best step to take? Now, knowing side effects of opioids, respiratory depression, is that something safely to do in an older client? We may be skeptical because of the risk factors. So, best thing, keeping the client's safety in mind, ask the healthcare provider to add something. This is what adjuvant therapy is. Okay, adjuvant therapy, you can keep the methadone at whatever dose it is at, but adding another medication makes the methadone work better. So it's almost like you got an increased dosage, but you really didn't. You're still taking your same regular dose of the methadone. The doctor just added an adjuvant drug to make the methadone work better. Okay, that is a benefit of adjuvant drugs. We use it a lot for kids, especially babies. Okay, preemies, NICU babies. We know that, preemies, they have surgery. They need drugs management too. We do not undertreat babies in the NICU. Everybody gets pain management if they've had a major surgery or if they have pain or something like that. However, we cautious. We don't want to give you too much because we know of the risk. So we give you a little bit of this medication and then add something to it. Again, it's going to make your opioid work a lot better. Okay. B would be inappropriate. Again, you might, cause this client to have an increased risk of side effects or adverse reactions we do not want to have, such as respiratory depression. Okay. C is inappropriate. This client is not showing signs of an overdose. That was what naloxone is for. Okay. If you have a client with an opioid overdose, they are unconscious, they aren't replying. Okay, then we will go for the naloxone. And then lastly, you do not need to place the client in a rehabilitation program. There are no signs or nothing in the question indicating this client has developed an addiction or any other type of condition that requires rehabilitation, detox, managing withdrawal. It hasn't said anything just yet. Okay. And then last question, number 10. A nurse is teaching a client who has developed a drug dependency about withdrawal symptoms. What will the nurse include in teaching? Select all that apply. A, one of the first symptoms of withdrawal will be a headache. B, drink fluids to help with the withdrawal. C, the only problem will be drowsiness. D, nausea and muscle pain may occur with withdrawal. E, try to stop the drug all at once to lessen the withdrawal symptoms. So if I'm educating a client about withdrawal after they've developed a dependency, because I need to educate how to manage your dependency moving forward, what should I include in my teaching? I see ABD, ABD, AD by itself, a lot of ABDs, AND. Okay, so we seem to be incongruent, some AD, some AB and D. Okay, so let's see what the correct answers are. The correct answers are yes, ABD. Congratulations, those of you who put ABD, because I know these select all that applies be turning y'all every way but loose. I trust me, I know I was there. I could not do select all that applies. It gave me trouble also. So let's see why ABD is correct. A, absolutely. One of the earliest signs that you're going into a withdrawal will start to be a headache. Then you start seeing the GI symptoms and any other symptoms. So absolutely. Depending on how severe your dependency is, it could stay mild, like headaches and GI, or it can turn into depression, it can turn into seizures and so forth. B, definitely drink fluids to help with withdrawal. Because the client is nauseous and vomiting, they may not have a lot of intake. Okay. When you do not have a lot of fluids intake or you are doing a lot of vomiting, you can have what we call an electrolyte imbalance. Okay. It starts with dehydration and then it turns into an electrolyte imbalance. We definitely do not want the client to develop an electrolyte imbalance or dehydration. So we're going to encourage fluids intake. Okay. In between the nausea and vomiting, hopefully, if you can't, eat, try to at least get some fluids in your system. Pedialytes, or there is adult electrolyte fluid replacements. I say it Pedialyte because I'm used to working with kids, but any type of, adult beverage that replaces electrolytes or important nutrients while you're not eating appropriately would be a best option. C is incorrect. Of course, you will see maybe some drowsiness or you may have insomnia. Who knows? Everybody reacts differently, but that is not the only issues you will have when it comes to withdrawal. And I give you guys an NCLEX tip. When you are answering questions, and let's just say you was confused or didn't know what answer to select, anytime you see words like only, all, those are typically incorrect options because it is placing everything into one category, leaving no room for flexibility. Remember, everything is not black and white. Okay, so telling a person that you only will see drowsiness, I am not educating them correctly, right? Never. When you see keywords like that, and see, this is test taken. If you see keywords like that, immediate red flag regarding an answer. Okay, D, of course, is correct. Nausea and vomiting can occur. Also, muscle pain can occur when you are going through withdrawal, muscle tightening, muscle spasms. And lastly, try to stop the drug all at once to lessen withdrawal symptoms. Absolutely incorrect. Remember, if you have developed a drug dependency, stopping the medication abruptly will send you definitely into withdrawal. So we never stop a medication or drug you've been taking for an extended period of time abruptly because of the risk for withdrawal. Instead, we taper little by little, or we wean you little by little off the drug medication. Good job, you guys. And that is the end of tonight's webinar. Are there any questions on drug dependency? Again, you guys are welcome. I'm going to put into the chat again the link for our webinar for you to leave you guys are welcome for you to leave your input. Okay. 9 out of 10. Good job. Getting better. See, that's all you got to do. Just keep practicing. You guys are welcome. Now, remember, if you want to have access to the webinar, yes.
What color you need to be the practice, right? They will give you
Okay.
the color green, orange, red.
You should also see the percentage. Now, if I would be, if I was, let's just say I didn't know, green is good. Red, stop, yellow, maybe. Green is go. But you should also get a report with a percentage of how well you did. It should give
Professor?
you some percentages. Yes.
Oh, yes, I'm sorry. I was on Naxlex website the whole day. Uh, there I'm actually going through all the previous webinars, and
Okay.
I'm on page 7 of 9. Most of the previous webinars, I couldn't access the slides. It's like the button's not there. Like, is it under maintenance right now?
That is a great question. Let me see if anyone in the chat. If there is no Naxlex leader in the chat, let me see. Usually,
One thing about the professor, one thing about the previous webinar is if you're accessing it through your phone, you might not be able to get nothing.
oh, well, there it
You
is. It
gotta go
might
to
be a
your through your
browser. It
computer.
very well, I was just about to say it very well could be a browser issue. See if that's the issue, Abby. I would suggest Chrome. I'm just a Chrome person, but it could be a browser. If you are still having issues with accessing, you can always contact customer support, but try that first to see if
Yeah,
it's the
they're all
browser.
there. If you access it through the PC, all the videos are there, everything.
You
I
guys are
tried it too
welcome.
once. I tried going through my phone. I never got it until I went through my PC, so I was able to access everything, all the ones I missed.
Yeah, and try that. And if your browser needs to be updated, maybe try that also and refresh. You can always restart your computer. I sometimes have to do that. Even with my updated system, I have to check, make sure all my updates are. And then sometimes I've had to just totally restart my laptop because I couldn't click or I couldn't do something. So try that first. If you're still having issues, you can always reach out to contact support, customer support, and they can maybe direct you and tell you what's going on. But I do not know for sure. Yeah, Chrome. I love Chrome. I don't know for sure. I don't think the site is under maintenance. I know they're updating, but you should be able to still access the webinars and the videos. You should still be able to do that.
Okay, I'll do that. Thank you.
You're welcome with this soft voice, which I had to do like this a little bit to hear what you were saying.
Sorry. All
No
right. Have a great
problem.
evening.
You're welcome. How do I know when the next Zoom is? Okay, Miss Erica. So when you go on the website, okay, there is a link that talks about sessions. Now, sessions are typically held every night, 2 time slots, okay, 7 p.m. to 9 p.m. or 9 p.m. to 11 p.m. And when you go to tutor sessions and you look at the calendar, it's going to tell you not only the time if a webinar is scheduled, but it's also going to tell you the topic. Okay, so it's under the link of tutor session. Somebody is outside shooting fireworks. Like, how do you get access to fireworks in June? But anyway, so that's how you would access to see what other tutoring schedule. You're welcome. You're welcome. How can I tutor cats after doing them for revision purposes? So the cats, you should still be able to see them. I'm not sure if you're losing access to them, but as you answer each question, you should be. Are you asking, can you restart them, maybe, if that is the case. Maybe if that is, but if you're having trouble accessing them, because my understanding is you should be still able to access them. If you're having issues with your subscription, I would ask you to contact customer support to see what's going on. Okay. You're welcome. You're welcome. You're welcome. Using NCLEX QBank, how can I select less than 85 questions? I'm not really sure. So they have quizzes where you can select certain numbers for questions. I would probably contact customer support because these are technical questions. Okay, y'all know I am the worst techie person in the world. I don't know how to operate nothing. So I would suggest you reach out to customer support and just see if they can help you with those technical questions. You're welcome, Raquel. Good night, Juliet. I've been seeing you here and there. Thank you, Oma. I appreciate it. Remember, you guys, please click on that link and give your input. And I will see you guys. I will see you guys Sunday. I see you, Comfort. I will see you guys on Sunday. I'm sorry, not Sunday, Wednesday. I do have some more adult health topics to cover. I was just given the okay, so you guys will be seeing me schedule some additional adult health topics. Okay. Okay, you guys, thank you so much. Y'all so sweet. So this is our webinar. We're ending. I will see you guys Wednesday. Okay, 9 to 11. Thank you, Noah. You guys have a great night and be safe. And again, I will see you guys on Wednesday.